All right, well, I saw Dr. Dale Myers present right here in this hotel for the IAASC conference a few years ago. I was very impressed, and he's got a great website as well, full of lots of tips. Is your website referenced anywhere in the handout? Okay.
It's down right now.
Oh, it's down right now.
We're in
Okay.
the process of making some changes.
Okay. Great. Okay. Well, Dr. Dale Myers, thank you.
Make sure I have all my mics wired up here. If I go anywhere near the water, I'll probably get electrocuted. That's okay. It'd be a fast and good way to go, maybe. I don't know. Good morning. Good morning.
Good morning.
Okay, just making sure, just checking to see if you're there. Good. I'm glad you're here. Thank you. I want to get to know you a little bit. I want to also say thank you to the folks that set this up. Thank you to Sherry for inviting me. It's fun to come back here. I had the chance to do my internship up in Mount Prospect and over in Schaumburg. And my best friend from graduate school is down the road. I see we've got some folks from LADSI here. My friend Sue Gallagher worked there for a while, is now in 102 for this year. So I love coming back out here, and to be honest, it was really nice just to see sunlight for a little while. So it was good. I was telling Izelle that when I was out here on my internship, I went with the 5th grade group to Oregon, Illinois. And I actually had somebody look at my Oregon plates and say, "Are those special plates?" Said, "Not in Oregon." So it's fun to be out here. Thank you for having me back. Thank you to Marilyn and Izelle from the center for helping set up. And I also want to say thank you to Tracy for interpreting. If there are others in the room that need interpretation service, you're welcome to move up here in the front table and we'll take care of that. Okay. I'd like to know a little bit about you. So if you would help me out, how many general education teachers are there? Special education teachers? How many administrators? School psychs? Social workers? Counselors? Instructional assistants or educational assistants? Who have I missed?
Speech pathologist.
Speech path. Excellent. Okay. Audiologist. Okay. Who else? Does that have it covered? Tell me where in the state. How many are from here in the greater Chicago area? Did anybody come in from another part of the state? Where from? Rockford. Okay. Champaign. Okay. Marion. Anybody from far south end in the state? Is that what it is? Okay. So I discovered about a year ago when I was out here for the IASE conference that my family name actually comes out of Clinton County. And I didn't know that. My dad didn't even know that. So it'll be fun to come back here from time to time and go down and find the people I'm related to down there. So good. A couple of other things in getting ready for this. Well, maybe I should tell you a little bit about me first. I want to tell you that my expertise is not in working with hearing impaired populations. That's your expertise. And what I'm going to do is provide you some information about functional assessment, working with children with challenging behaviors, those kinds of things. And we'll work together on the application to your kiddos. I also want to tell you that I'm not a physician, nor am I a lawyer, neuropsychologist. I'm a school psychologist by training. And the reason why I say those things is because I will talk just briefly about some issues, legal issues, ethical issues, some of those things. Not necessarily my area of expertise to go a whole lot deeper than what we'll talk about them today, but I can certainly point you in a direction if we need to. My background is, and I sort of say this jokingly, I was the accidental educator. I didn't intend on getting into education. I ended up in education because I graduated my undergrad. Well, I should back up maybe just a minute. I actually got into college thinking I wanted to be a vet. That's all I had wanted to be, was a vet. And then I graduated high school and suddenly realized I have no interest in being a vet. I don't want to be up that late. I don't want to stick my hands there, those kinds of things. So I did theater for a few years and had fun doing that, and everybody I knew was starving. So decided that I want to try something different. And so I got into psychology, and I really had a lot of fun, added sociology, and when I graduated college with my undergraduate degrees, I thought, well, what do I want to do now? I think I want to go towards clinical psychology, working with kids with challenging behavior. But I thought I'll take a couple years off and work, and so I went to the county office of employment and looked for the first job I could find, and it said counselor. I thought that's really exciting, and I ended up working as a case manager for a developmental disabilities agency. I did that for several years and started working as a resource coordinator doing training, and that's when I discovered how much I loved teaching. Teaching is really an amazing, amazing thing. It's an amazing profession, an amazing activity to do. So I'd been doing that for a few years when I got a call from a school. It's a school that they call a school of last resort. It sounds inviting, doesn't it? When students in Southern California had gone through all the city schools and the county schools and the SELPA programs, when there was no longer anything that was publicly run, they would come to us. And we were what was called a zero reject school, meaning that if the student was eligible and appropriate for our program, then they didn't leave unless they got better or turned 22. And it was really interesting because they invited me to come be a director of the school program, and I said, no, thank you. And they said, but we think you can do this. And I said, well, I don't think you understand. I'm not trained as an educator. And they said, no problem. You will have a curriculum coordinator on your campus, a veteran teacher who will mentor your teachers, and the curriculum and instruction director for the series of campuses will be in the executive building, which is right across the parking lot. I said, okay. So I'm not sure that helps me, but keep talking. And I kept saying no, and I kept saying no, and they thought I was being a shrewd negotiator. I thought I was saying no. And finally they said, what would it take? And I was ridiculous, and they said, okay. And I said, oh, well, wait a minute. I ended up being the director there for 4.5 years, and I just fell in love with kids with challenging behavior and fell in love with the educational setting. But I wanted to know more about education, and that's when I went back to U of O to get my doctorate in school psychology. And I was fortunate enough there to work with folks like Rob Horner, George Sugai, Hill Walker was my mentor, folks that did issues of school failure, juvenile delinquency, and systems of support. If you're familiar, how many of you are familiar with PBIS? Okay. So it sounds like maybe there's a little bit of a range in here, which is sort of what Sherry had indicated, from folks who are very sophisticated in PBIS and some that probably are not familiar with it. That's fine. But one of the things I discovered was how important it is to set up systems of support when working with challenging behavior. So if I've got a student who is struggling, working with that student is nice. But if we don't have a good system of supports program-wide or school-wide, we're not going to get the best out of our work. So I really enjoyed, over the past 10 years now, working with positive behavior support and some of those issues, and still bringing in my interest in working with kiddos with challenging behavior. So that tells you a little bit about my background. 4 years ago I went independent and have been enjoying traveling to places I want to come to and spending time with people I like spending time with and spending a little more time at home. Over the course of the day, one of the things that you will see is that I will infuse my professional philosophy into many of the things we talk about. I believe it is vitally important that you understand your own professional philosophy. Why? Because you have one, and whether you're cognizant of that and whether it's explicit or whether it's implicit makes no difference in the fact that it will guide what you do. It will guide your practice. You will hear it in many of the things I say, and sometimes it will be explicitly laid out in some of the slides and some of the things that we talk about. But I want you to think today about what your belief system is, what your philosophy is, and how it drives your practices. So that's a little bit about me. If you want to know more, please feel free to ask. Terminology. What is the terminology you use for a plan to support students with challenging behavior? A BIP, behavior intervention plan, okay? There's a lot of terms for it out there. There's student support plans and individual student support plans and behavior intervention and behavior support plans. I will tend to use behavior support plan, but understand that from my lexicon, those are all the same. Now, I understand in Illinois, you use the term PBIS. Understand that I will probably often use the term or use the phrase PBS, meaning exactly the same thing. So just some basic terminology as we get started here. Some expectations to get us started for the day. First one, learning, participation is valued. I want this to be useful to you. I have to tell you, I was nervous about today. And I'll tell you why I was nervous is because when Sherry and I talked I don't know, we actually set this up at least 6 or 7, maybe even 8 months ago. I don't remember when it was exactly. But when we talked just maybe a month or 2 months ago, she said, so just to let you know, Terry Scott's been here, and they've heard this 2 or 3 times before. And I thought, oh, great. They're going to all be going, okay, who's the newest guy to tell us how to do this? I really want to make sure this works for you. So I've put in more slides and more information than we will cover today. Why? Because I will look for feedback from you on the things that you already are pretty comfortable with, confident in your knowledge about it. As we do that, I'm going to ask you to help me shape the training. So in just a few minutes here, I'm going to give you a little activity. Are you sitting together in teams? Okay. I will ask your team, and you can join a team. You are your team, right? Helene is her team. I like that. Some people ask me, what about your family? I say, I am my family. So we'll have you get together with your team or with another team, and we'll shape today's training just a little bit. This is where I try to make sure I avoid embarrassing myself. So limiting distractions means I try to make sure that I have my phone on manners mode. I would ask that you do that as well. If it doesn't have manners mode, I understand. If you need to take an emergency call, I understand that as well. I just encourage you to limit distractions whenever possible. Okay. I love to tell stories. You'll see that as the day goes on. I have to tell you a story. I was in Omaha, Nebraska a couple years ago. It was a 2-day training, and the first day of training I made the same comment about shutting down cell phones and pagers and those things, and I could see this woman kind of shifting uncomfortably, and at the break she got up and she came to me and she said, Dale, I just have to tell you, my son just started in college, and his roommate was just in a horrible accident, and I have to keep the phone on so that I can take a call in case there's a change one way or the other. And she said, my phone is an old phone. It does not have a manners mode, so if it rings, it will ring out loud. I said, don't worry about it. It really isn't a problem. I just, in general, would prefer that they be off. But there's always those circumstances that we have to take into account. I think she maybe thought I was blowing her off or didn't believe her, because the next morning, she came in with a newspaper. Now, my business partner, Patty, was standing next to me, and Patty has a tendency to sometimes laugh when other people might think it was inappropriate. Like at funerals and when people are dying. And so Patty and I are standing there, and the woman shows us the newspaper. And she said, I wanted to show you that, this was my son's roommate that was in the terrible accident. And I see Patty's shoulders start to bounce. And I said, that's fine, just go ahead and go back to your seat. I want to get her back there. And I turned to Patty, and she's starting to, she had to cover her mouth, and she's starting to giggle. And I said, what in the world was that about? She said, I'm not exactly sure what the headline read. I said, the headline read, man reportedly hit by train. She said, oh my word, I thought it said man repeatedly hit by train. Okay. The over 18 rule. Misery is optional. Restrooms, if you go out the door, are down to the left and on the right side. We've got, I think, some juice in the back, some pitchers of water, some coffee, and some goodies. At any point in time that you want to stand up, lay down, sit down, do yoga in the back, use the facilities, please do so. I don't want to have to worry about your physical comfort and well-being. So I don't have a problem with that. I am very serious about that. We will take breaks. We will have a lunch break. We'll take a break this afternoon. But I want you to take care of yourself and be comfortable. I don't really stand a lot on formality in that sense. I have had people doing yoga in the back. I wasn't just joking. I'm fine with that. I sometimes say I'm not easily distracted, but that may not be true. But if I go off on a tangent, I'll try to keep it interesting and somewhat relevant. At times when we're talking about students with challenging behavior, you will have a flash that will hit you, and you will see that student very clearly in your mind's eye. You will see their name, you will see their file, and here's what I want you to do. Bring that information into play without the name. Okay? I want to be very, very careful that we do not break any issues of confidentiality here. I'm not saying don't share. What I am saying is share and change the information enough that there is no identifiable information connected with a student's information. Does that make sense? Okay, thank you. Have fun, safe and respectful environment. Anything else that we need to take care of? Housekeeping information. Have you been in this room before for the training? Should we like turn the whole room sideways and make it look different? Would that help? Okay, good. Well, I told you a little bit about my concerns that having heard this 2 and 3 times before, that you might be dozing off by about 9:40. I want to try to keep this interesting and useful to you, and so I will ask that we shape this. I will show you what I have planned, and then what I'm going to have you do is give me some feedback. So here's some things I have planned for today. We're starting off with the welcome. I want to talk just a little bit about some historical, and these top 3 pieces here will be fairly brief, historical perspectives on aggression and antisocial behavior. Talk a little bit about ethical perspectives. What are the ethical realities that we deal with when talking about children with aggressive or antisocial behavior? We'll talk about some legal perspectives. Talk about the role of research-based practices. Why is that important? What do we do? Why do we do it? Talk about evidence-based approaches at the systems level and at the individual level. One of those pieces at the individual level is I want to know if you have been trained in a form of managing the aggressive escalation cycle. How many of you have been trained in something like PART, CPI, MAB? So some of you may be familiar with this cycle. That is something that we can talk about or not talk about as you choose to be of interest. We'll talk about assessment in general. We'll talk about functional behavioral assessment and FBA-based support plans. Think you have an idea where I was coming from with this? Does this look familiar? Some of the same things you've heard before? You're already starting to get glazed, going, oh my God, 9:30 to 2:30. Okay, here's what I need you to do. I would like you, with your team, to get together, take about 4 or 5 minutes. I want you to answer 2 questions. Number 1, what do you need from me today? What do you need from me today? And number 2, what makes training or workshops, seminars useful in a generic sense? What kind of things do you like in workshop seminar settings? 2 questions. What do you need from me today? And in general, what makes training useful, practical, beneficial to you? Questions about the task? Great. Take about 4 minutes. May I have your attention, please? I'd like you to share with me some things that you're needing from today, or expecting or hoping for today. Yes?
I think that one of the challenges we face as staff at ISRC is, we do have an understanding of how to write and do the FBA, VIP. I certainly, and I know many of us come from a mental health background. I think that the difficulty we face is that we're trying to get somebody else to implement a plan that we come up with. So I think the engagement piece, because we aren't implementation.
Okay.
I think that would be helpful.
So implementation issues. Okay. Other things? Yes?
What are some of, or where can we find some of the research-based positive behavior supports?
Okay. So a little bit more about positive behavior support. You're in luck. I actually plan to have that in the presentation, or maybe I'm in luck. Yes?
We have a question about when you have a class, and it might be a small class of 6 kids, but they all have plans.
Yes.
How do you deal with all those different plans and being accountable, collecting the data, and making it useful?
Is cloning off the table? Just kidding. Just kidding. Okay. More implementation issues. Yes.
We had several questions, but one of them is kind of the flip side of what the woman in the gold asked is it better if the person that's doing the assessment and writing the plan is inside the team or outside the team?
Good question. We'll talk about the makeup of the team and the process for doing that. Yes?
Dealing with kids who have autism and particular behaviors with that, how do you differentiate between a behavioral issue and a sensory issue?
Okay. Good. Okay. Issues of autism. Margaret.
If there is no team.
What if there is no team?
There is an I in team. Because we swear, because we're on our own. We need counselors, we need a support staff, we don't have enough interpreters, so we can't really utilize the system that our whole school, has in play. We have a room where they can go and refocus. And we can't do that because we don't have anyone that can go with our kids. And then if we do, it's just a lot better to do it on your own directly, and we just really don't have that system.
Let me ask a question of all of you. How many of you are in a general education setting? How many of you in the general education setting are isolated somewhere in a portable or somewhere separate on the same campus? Okay, so you're really sort of on your own, right? Does that sound okay? How many of you are on a completely separate campus or in a completely separate setting? So I don't know that everybody raised their hand. Help me out with what the other option is. Was there another option? Okay. Special school. Okay. How many of you are in a special school? Okay. Yeah, some of that matters actually, doesn't it? If you are in an isolated setting on a general education campus, you often have less support, less staff help, and in some cases, maybe just the opposite of help. Maybe you're out there because they see you as being separate, on your own, isolated. Okay, other issues. Yes?
We're interested in hearing more about the aggression escalation that you mentioned.
The aggression escalation cycle. Okay. How many of you would like to hear just a run through on the escalation cycle to sort of refresh how do we recognize it, how do we prevent escalation, some of those issues? Okay. Good, we can do that. Other issues that you would like covered today? Sherry.
We hear people having challenges with going from data collection from the FBA to the designing of the behavior intervention plan.
Okay.
And as an example, say you've determined through the FBA that escape is the function of the behavior, then the challenge is designing a behavior intervention plan that meets the same function of escape when you've got the teacher saying, I'm not going to allow him to escape this task.
Excellent. Okay, so that issue is the behavior support plan function-based? Really, I mean, did we just waste our time doing an FBA, or are we going to utilize the functions that we've identified or function that we've identified to guide our behavior support planning? Good. Other things that you need from today? Yes?
This is our fourth meeting, so
Okay.
we have a lot of information, and that's somewhat overwhelming. How do we get to the bare bones?
Okay.
Kind of like a stepwise, tell me what I need to do first, second, third.
Okay. The skeletal look at it. Okay. How many of you heard anything about philosophy in the last presentations? Have you already been through sort of what the purpose is, what the background to FBA and some of that? Sort of, kind of, the legal issues? Okay. Because what I thought I would do is sort of set it in a broader context so you understand why you're doing it and when to do it, more than just you do it when the behavior is escalated to the level that all those things. Does that make sense? Okay.
We said legal issues. This is one of our things we wanted to hear more about.
Okay, legal issues is something you want to hear more about. Anything else? Yes?
Just kind of a review of functional behavior assessment.
A review of functional behavioral assessment. You're in luck. I actually came sort of prepared to do it either, very simply, but I have a lot of other things in there. There will be slides up here that you don't have in your packet. Part of that is because if I put every slide in your packet, you'd be getting a hernia trying to carry it around. I also am from Oregon, and we want to keep one or two of our trees alive. But what I have sort of ready is that piece of, we've got some basics, and we go into a little bit more. There will be some slides we won't cover a great deal, but you will have as resource information. Just to let you know, just to make sure you understand this, there are 3 packets that you should have. One of those is the PowerPoint presentation packet. Right? Has the little PowerPoint slides. All of you have that? It's the only one of the 3 that's 3-hole punched. You also have a packet, 2 packets actually, that look like this. It has the pyramid on the front. One of those says practice in the upper right-hand side. One of them does not. The one that has my hand scratched practice written in the upper right-hand side is just that. It's for you to play with, to write on. We may use it today. Probably we'll use it today. The other one is a master packet for you to take back and photocopy if you should choose to use these forms. I want to be very clear. I am not at all invested in these forms. It makes no difference to me what form you use. It makes all the difference in the world what you do with the forms. The forms should not guide your practice. Your practice should guide the use of whatever form you have. We'll talk more about that. Okay, tell me in general terms, what are things that make training specific useful for you? What are some of the things that you came up with in generic terms? Yes?
Having specific examples. We've heard about the behavior plans. This is what it is. This is what you do. But I want the specifics of, okay, we know how we're supposed to do this now. Okay, what do we do?
So one of the things, I thought about bringing a bunch of case studies. And actually, here's what I would like to do. I would like us to actually, I want you to be thinking, there's probably a prompt in here a little bit later, you to be thinking about some of your case studies. And I want to walk through the process, and we're going to put our combined skills, knowledge, things that you've learned together, and do a little problem solving. I sometimes think that that may be a little more helpful is when it comes out of the audience and we can sort of walk through it, talk through it there. Does that make sense? Does that get to what you were looking for? Okay. Yes?
I'd like to know how to apply it to a group instead of just an individual, because we've talked a lot about an individual person, but sometimes we have classrooms themselves that need to be reassessed for behavior plans. And since we're talking about the RTI model, we usually want to start at the core anyway.
So putting it back into the 3-tiered prevention model and talking about universal interventions, talking about moving up to secondary interventions, secondary prevention, before we start talking about doing an FBA, which is a red zone, targeted, intensive, individual intervention. Okay? Other things that help making seminars, workshops useful to you. Should we just dive in? Okay. Case studies. I think we just mentioned this. Jennifer. We'll try to model the process for you. Going through that, I want you to be thinking about somebody that is a concern for you, and we'll talk more about that. I want to start off with 5 big ideas. This goes back to the issue that philosophy guides practice. I believe my personal and professional philosophies are pretty closely aligned, although they have a different focus. But my professional philosophy guides my practice. Let me give you an example of that. In general, thinking about parenting or teaching, one of the big ideas that I work from is that all children can learn. That's no big surprise. Not only that they can learn, but that they are learning all the time. Not just that children can learn, but they are learning all the time. How does that drive my practice? Well, there's a couple ways it drives my practice. Number one, it drives my practice in the sense that if a child is at school, they're learning from the people there. Learning, teaching, education does not begin and end with the teacher in the classroom. It would be wrong to think that students stop learning when they leave the classroom for recess or passing periods or to go home. They're still learning. That's the first piece. The second piece is, if you work with students, you're a teacher. I do not differentiate between a person who is a certified teacher or a person who is a classified teacher working as the custodian, working as the lunch lady, working as a bus driver. Kids are learning all the time. That means people are teaching all the time. We have to understand then that it's not, I'm going to choose to teach. The question is, what are you going to choose to teach? Big idea guiding my practice. I want to talk about big ideas, 5 big ideas for today's focus. Number 1 is behavior is lawful. Now, I don't mean that it doesn't break civil codes, legislative codes. I simply mean that it is not completely incomprehensible with a couple of exceptions. Those exceptions would be children who have severe mental illness or children who are actively involved in substance use and abuse. But talking about whether it's autism or talking about kids with fetal alcohol syndrome or other things, we often go, well, they operate completely differently. That's not been supported by evidence. In fact, their behavior is lawful. It may look different when we talk about the description of the behavior, but it is lawful. It follows rules. Number 2, data is critical. There is something I learned very early on in education. One of those pieces was, maybe you recognize this, I got into education and then there's those days where you go, this is the coolest job in the world, right? I love working with kids. I love seeing that aha moment when the light comes on, and it's just really exciting. And then there's those days when you say, what was I thinking? Couldn't I have chosen a different profession, something that paid well, something that gave me, and you go, wait a minute. My question is, did the kids suddenly change? Did my ability to affect their future suddenly change? Because on those days, I can go from thinking, I actually make a difference. I change the future. What I do matters, to nothing I do matters. I'm not impacting these kids in any kind of positive way. And the reality is, neither one of those is exactly true. If we're not collecting good information, good data to let us know whether or not what we're doing is working, we will often be misled as to whether an intervention or a program is effective or not. The use of data is critical to help us assess what we're doing. We also want to focus on changeable events. What does that mean? In social services, my experience has been that we love to connect and we love to talk. And oftentimes we'll talk about things that we have no control over. You know this kid's family, have you seen the home where they come from? And we'll start talking about the community and the state of civilization and, you know, where am I and why am I in this handbasket, right? The fact of the matter is that's all interesting and completely useless to us as educators. If we are going to focus on interventions, we must leave those discussions outside the classroom, outside the school, and focus on things over which we can change, have effect, make a difference. We need to focus on changeable events. The fourth one is a continuous improvement is possible. The FBA is based on the scientific model. We collect information, we define the problem, we look at an intervention, we select an intervention, we put it into play, we look to see if it works. If it doesn't, we tinker with it or change it until it does, or we get rid of it. If it does work, we keep using it. Now this has been a little foreign in education in some ways, hasn't it? Because education has kept many things, utilized many things that had no evidence to support them. And we've avoided things that have been evidence-based. We're going to talk about the importance of being evidence-based, but we need to think about continuous improvement as that ability to learn something each time we try and to not keep making the same mistakes over and over. My brother lives just up the road. He works as a flight safety director for an airline. He says, I don't mind hiring pilots who make mistakes. I mind hiring pilots that make the same mistake over. I think you'd probably agree with him because we all make mistakes. The question is, do we learn from what we're doing? Teamwork makes a difference. I will tell you that the whole area of FBA and behavior support planning is built on the concept of teamwork. Why? It comes out of the positive behavior support framework, which is a systems approach. It is team-driven, data-based. We will talk about who needs to be on a team, but like many other things in education, being the Lone Ranger here is not a good idea. It is not a good idea. And I know you've gotten stuck with that in some cases. We need to talk about what we might be able to do to encourage other people to be involved with this and who those other people might be. Okay. Questions about those? Thoughts, comments? Yes?
When you talk about focus on changeable events, you mean that we should recognize that unchangeable events and how they impact our changeable events. That's what you're saying. You're not saying just focus on what we can change and ignore everything else.
I think it's not a bad thing to recognize that children may be experiencing what they're experiencing because of upbringing. The problem comes when we spend all of our time talking about what's happening in the family, and did you know Dad got arrested this last weekend, and Mom was using drugs. There is a time and a place to have that discussion, but there's a time and a place we need to stop that and move into what we have control over. And oftentimes I've sat in IEP team meetings and I hear over and over and over comments about the family and parents in things in which we have no control. We are not directly able to impact. I'm saying it's okay to recognize the impact, but we need to be careful that we don't move from understanding to gossip. And I think, again, that piece of connection, we have a desire to talk. It appears, some of the research indicates that we may be hardwired to gossip. Humans may be hardwired to gossip. And what is that about? It indicates that there's probably value in social connection. We just need to make sure we understand what we're gossiping about, what we're sharing, and the information, that it's information that is useful, practical, that it leads us to better outcomes for our students. Actually, one little sidelight, my business partner, Patty, she connects with people very well, and she talks with everybody. And one of the things that she's taught me is good gossip. She said, I love to gossip. I always try to make it good gossip. If I hear something about Marilyn that's really nice, I come to Helene and say, did you hear about Marilyn? She won this great award, or she does this great work, or did you see what hey, Ezell, you know what? And then I tell Marilyn, hey, Marilyn, you know what I heard about you? This is so cool. Good gossip. Just sort of a different way of shifting the idea of gossip. But I think when it comes to team meetings and basing interventions, we need to focus on things that we do have control over. Does that answer the sort of, kind of? I'm not ruling out understanding the family background or understanding the social situation. That is not it at all. But I do think we need to be very cautious when we start getting into a loop that keeps recycling the information about the family, unless we have the ability to interact there and make a difference. If we do, I'm very supportive of that. Historical perspectives. Interpretations are based on context. When we talk about antisocial, aggressive behavior, challenging behavior, whatever we want to call it, we need to understand that the interpretations are based on the context of those interpretations. We can talk about the historical era. Over time, definitions have changed. The professional setting. If you're speaking with a minister, he's going to interpret behavior probably somewhat differently than a psychologist, than a police officer, than a teacher. The professional setting matters. The immediate situation matters. The desired function matters. In education, if we're trying to find a student eligible, our eligibility hasn't moved to that RTI model of they need support quite yet in most areas, right? We're still talking about, are they found eligible based on a certain bunch of categories? If our need is to diagnose for getting insurance coverage, we use a different process, different definition, different understanding for that. Why does that matter? Because we have different definitions, and those definitions often get crossed up. For example, if you talk to somebody in a religious sense, they may talk about sin and moral deviance and some of those things. If you get down into the medical field, they may talk about definitions that have nothing to do with education. And if you talk to them about a student, remember that the term used to be SED, for behavior, right? Seriously emotionally disturbed. And you talk to a medical professional about that, they would look at you in some shock, because that's not the terminology that they used. We need to make sure that we know what we're trying to do and that we look at where our definition is. Even in school settings, I've seen people choose out of some of these other areas, and it will guide our interventions when we have different definitions. Here's just a little piece about interpretations along this continuum from the past to the present. Early on, there was more definitional use of religious interpretation. Somebody was possessed. Believe it or not, in the last 10 years, I've had people tell me that they thought their student was possessed. They were serious. Now, I have to tell you, if you have that kind of definition, we might as well stop now, because FBAs are not the answer to possession. I'm not sure, where you go from that. But the question is do we have a definition that is incompatible with our goal? Psychosocial definitions, system-dependent definitions. My question to you is, have you heard people in your school or in your program, in your classroom, talking about students with severe behavior? What terms do they use? Are they supportive or judgmental terms? Have you heard people talk about bad kids? The kids I worked with ranged from what I jokingly referred to as IBD, irritating behavior disorder. They irritated the wrong person, all the way up to kids with grand theft auto, sexual assault, attempted murder, arson, a lot of things. And in all that time, I never saw a bad kid. I saw kids who had been through some real trauma, very serious trauma. One of my students had been locked for 7 years in a closet. He had no language skills at all. It was horrifying. Had a kiddo that had been left in the backyard with a collar and a dog chain fed out of a dish in the backyard. Now, when you think about those things, how you look at the behavioral result of that matters in terms of the interpretations and in terms of the activities that we will use to try to change those things and give those students positive outcomes. I'd like you to just turn to the folks at your table and take a look at these questions. You'll have about 3 minutes. What terms do you hear used? Are they supportive or judgmental terms? Do they describe the student, or do they describe the environment? Is this a student problem or an environmental issue or some transactional piece of that? Take about 3 minutes right now and have that discussion at your table. Two and one. If I can have your attention, please. Thank you. This is just a quick little aside. If I want to go into a classroom, I get to measure one thing, and in measuring that one thing, I want to predict academic outcomes. What one thing should I assess, measure? What's the one thing that I want to assess? I'm only allowed to assess one thing. What one thing best predicts academic outcomes? Very close. Who said it?
What was it?
Somebody said time on task? Jill, thank you. Kudos. Academic engaged time is a moderately good predictor of student outcomes. If you want to take it to the next level, we move from just academic engaged time, the amount of time kids are spent engaged with the curriculum or instruction, to academic learning time, ALT, which is academically engaged and successful 90% of the time or better. What's the number one thing that reduces academic learning time? Transitions between areas and activities. If we build successful transition behaviors, we will increase the chance that we will be successful and students will be successful. And although I'm not going to talk much about academics today, I will tell you it is very clear in the research, and it's very clear in my experience, that the number one behavioral intervention, the single most powerful behavioral intervention, is a strong curricular and instructional model. When students are failing in the curriculum, they will act up, and that may be internalizing or externalizing, but they will act up. Okay. Tell me a little bit about your conversations at your table about the terminology that's used. What have you heard? Just what do you know about?
Usually they say they're disrespectful.
They often say they're disrespectful. Spoiled. A brat. Yeah, that's one of those you go, wow. A spoiled brat. Naughty. Uh-huh.
Mine goes strictly to ODD. It must be ODD.
ODD, okay. And you know, they're really hitting the jackpot when we say they're conduct disordered, because now we're not responsible for it. Right? We'll talk more about that piece of it. Sherry. Non-compliant. I'm just curious, how many of you are potential murderers? How many of you have someone in your life that if you knew that your willingness, maybe your child, maybe a parent, your willingness to pull a gun and shoot somebody would keep them from shooting your child or your parent? Now when you think about this, you say, well, what does that have to do with anything? It has everything to do with it. Because why? Because in the right circumstances, most people are capable of things they don't even want to think about, let alone talk about. When we talk about students with challenging behavior, in many cases, they have experienced things in their life that place them in circumstances where they do things that we think are inappropriate. We have to understand, if you understand functional assessment, we have to understand that behavior served a function, served a purpose. It was necessary and purposeful, useful, practical in that environment. Anytime we make a judgment about how a student behaves at home, we are forcing them to choose between home and school, and I think that's disrespectful of the student and the family. I'm not saying that I agree with how they were raised or I like the behavior in the family. But if we tell students that aggressive antisocial behavior is inappropriate, blanket statement, we're missing something. Now, I don't know your kid's background, but I do know enough about kids ranging from general education to the setting that I worked in to know that we don't always know what happens in their homes. And in some cases, antisocial, aggressive behavior is a necessary survival mechanism. They must use it in order to be alive and be effective in their home. And I am loath to tell them that they shouldn't use it. What I do want is for students to become bilingual. I'm talking about a behavioral language. The behavior language in most schools is white middle-class behavior. Does that make sense? Am I right? Does this sound? Now, I want you to think about this with regard to the language that we use. Think about a student. Most of our schools, everybody in the room, most of your instruction is delivered using what? ASL? Combination ASL and English. Okay? Now think about the language. What happens if this is a student who arrives at school who speaks Spanish at home? You've got those, most of them. If they arrive at school, in many cases, what has to happen is they not only have to learn the content, they have to learn the mechanism of delivery, the language that we're delivering the content. I want you to think about the behavior language. If students arrive at school and their home behavior language is white middle-class behavior, they don't have to learn the mechanism. They don't have to learn the behavioral language. They come with the same basic set of expectations and behavior. If they don't, we're going to need to teach them a new language. I have a friend who's a school psychologist who's from Hungary. Aggie told me one time, not long after we met, she said, "I'd love for you to learn a little bit about my country and my language." I said, "That'd be great." I've always wanted to visit Eastern Europe. That would be fun. Tell me about your country. And she proceeded to tell me about her country, and she wanted to tell me a little bit about the language. And so she spoke to me and said several phrases in Hungarian. And then she jokingly walked over, pulled out a dictionary, handed it to me, and said, "This is a Hungarian English-Hungarian dictionary. I'd love it if you'd just memorize it and speak with me in Hungarian." Now, think about this. How does this relate to schools? Oftentimes we have discipline codes and policies and procedures, and we give them the student handbook and say, "Read this, sign that you've read it, and we want you to act in this way." If behavior is a language, it's like handing them the dictionary and saying, "Speak the new language, here's the dictionary." What I want is for us to teach the behavior that we want, just like we would teach a language. We provide them the rationale for why learning the language is a good idea. We then teach them subcomponents of the language and how to put it together. And after they start putting words together, then we start helping them with their structure, their articulation, their fluency, and all of those kinds of things. And learning a language doesn't occur quickly, does it? Particularly by the time you hit 10, 11, and 12 years of age, our ability to learn language starts dropping very quickly. What we know is that if you don't learn a language before about age 10 to 14, depends on the person, the ability to speak it as a fluent native speaker drops very quickly. Well, think about the kids that we're serving and we're asking them to speak a different behavioral language. How do we do that? Are we willing to teach them in the same ways that we teach an oral language? So I say, I was over in Sweden a couple times this last year visiting family over there, and my cousins would try to help me speak Swedish. I think they found it more as a humorous activity than an informative activity, because I would say things and sometimes I thought they sounded like what my cousin had just said, and they would say, "No, what you actually said was something you don't want to say." The same thing is true. We have to be coached in the behavior. I want students to become bilingual. If they speak a different behavior language at home, I want to give them a new set of skills, teach them to walk into a setting and look around and see what fits that setting and be able to shift into that new language or that new behavioral language. Now, sometimes maybe you get this. This is what I do when I'm with my buddies. And I say, "I don't care what you do when you're with your buddies. That's between you and your parents. But at school, this is the language, this is the behavior that will make you successful. And I want you to know that you can choose when to use that and when not to use that." When we think about behavior, I think it's important to think from a skills perspective. What skills deficit or skills excesses do our students have? Okay, questions about historical perspectives. I'll usually stop in between sections and ask you this. Feel free to stop and ask questions at any point, but I'll just stop and check in. Ready to continue? Okay. Ethical perspectives. A very brief stop in this topic because this goes way beyond what we need to do today, but I want to just take a couple of quick looks at it. I think we have an ethical responsibility to create a safe and effective learning environment for all students. Is that a challenge? Yes. But I do think we have an ethical responsibility to do that. I think in order to do that, we have an ethical responsibility to use evidence-based interventions. Now, I come out of a medical background. My brother-in-law is an orthopedic surgeon who once said, "Dale, if I practiced medicine the way educators practice education, I would have been sued out of business a long time ago." He said there are still discussions around something that have been going on for 4 decades, like teaching reading. He said if we had a discussion for 4 decades in medicine, we'd have a real problem on our hands. People wouldn't trust us. People wouldn't want to use our services. Are we using evidence-based interventions, programs, etc.? Now, I'm going to take a chance of kicking the sacred cow. Anybody here use DARE in the schools that you work in? What do you know about DARE? There are 2 well-controlled studies that found a statistically significant difference using DARE. In both cases, kids got worse. And yet this is one of the most effectively funded programs around, or has been. DARE actually had to admit, I think it's probably been 4 or 5 years ago now, that their curriculum didn't work to reduce substance use and abuse. And they're now in the process of rewriting it. But why is it that that's so deeply embedded? That's about philosophy and beliefs. That's not about the practices that benefit students. Now, I'm all for saying it's great that we have law enforcement and education working together and kids get to see cops in a different light, but can't we give them tools that work? We also need to make a focus of prevention versus intervention. Education has been built on a practice of waiting around until kids fail adequately to support them. That is both foolish and disrespectful. It's foolish because it takes many more resources to correct a problem than to prevent a problem. And how respectful is it to say to a student, I'm not going to help you out until you've failed, made a fool of yourself, feel terrible about yourself, and then I'll intervene. We do know some things that prevent problems from occurring. We have an ethical responsibility, in my view, to do those preventive models.
I have a question.
Yes?
What you just said, I think we would all agree with. Do you say that to administrators?
I do. Actually, I'm a little more blunt with most administrators than I am with line staff, because in many cases the line staff gets stuck with things. Right? Yes. Yeah, it's and I have to say, in fairness too, this is a problem that goes way back, because take NCLB for example. The problem with NCLB to me is not where we're at and what we're talking about with testing. I believe in assessment. I believe in the use of good assessment. My problem is, why didn't we start talking about this at the universities? Why didn't we start with preparing people, administrators, teachers, etc., at the university to, number one, evaluate information so that they could have a conversation that was meaningful? I have this discussion with my father. And we get into discussions and he'll say, yeah, but research can be used to show anything. I said, not if you're a smart consumer of research, right? When you get this on TV and they say, red wine protects from heart attacks. Wow! Who do you think might want to support that? Maybe the red wine industry, right? One study doesn't mean a lot. Do we have a convergence of evidence? Do we know how to look at those research studies and say, is this good data or bad data? Is this a well-designed research piece? We need to do that. We need to start having those discussions, and we need to move out of ideology into evidence-based discussions. There was somebody else who had a hand up.
Sparks a parallel with the criminal system.
Yes. I actually, for those of you who know PBS, I was actually in a Kinko's. Makes it sound like I spend all my time in Kinko's, and sometimes I feel like that. But I was in Kinko's, and I was talking with a guy who was the head of the Department of Corrections in the state of Oregon. And Dave said, tell me a little bit about what you do. Because we had had this discussion, and just basically job titles. And I said, well, I do educational consulting. I focus on safe and effective learning environments. He said, have you heard of something called PBS? Just so happens I have, Dave. I said, that's largely focused in what I do. He said, it's probably no mystery to anybody outside of corrections that what we're doing isn't working. He said, we take guys in and we put them out and they're more dangerous, angry, hostile than when they came in. He said,